So over the last 12 months, I've been reviewing our epilepsy patients in the practice. So this all kind of started following attending a training course in Lincolnshire, which was run with SUDEP Action. And during this day, I heard some really interesting things around SUDEP for the epilepsy patients, and I heard from Elaine, Clive's sister, around kind of Clive's case and how things in primary care potentially could have altered outcomes for Clive. And so this kind of really piqued a bit of an interest. And then when I returned to practice, started seeing a few of the epilepsy patients for their annual review. And during the conversation, obviously you have your kind of templates for the annual review checklist. So as I was coming down and it was talking about SUDEP information given, I wanted to do the checklist with them, but first of all ask them whether they'd ever had a conversation around SUDEP throughout their diagnosis of epilepsy. And it amazed me that these were the first patients I was seeing in primary care, and the first three all said no, that they'd never heard of SUDEP, nobody had had a conversation, they weren't aware it was a thing, they weren't aware it was a risk, and that really surprised me. And then I started to work more closely with SUDEP Action and some of the developers from the System 1 and EMIS programs around could we make the SUDEP checklist more accessible, more visible, and improve awareness for clinicians reviewing these patients when they come to doing the review. I spoke to colleagues at my own practice, and again, none of them had really heard of SUDEP or were having these conversations when they were seeing the epilepsy patient. So I thought there's a real gap here, that we know that if we can improve awareness of the risk, and then we can reduce SUDEP from happening, but yet even our own clinicians are not aware of it or having the conversations. I spoke to our practice manager around sharing the link for the ExMon app to all our epilepsy patients, which we did. So that was really important to give patients a chance to kind of take control of management and kind of have a bit more awareness of their own risks themselves. So we shared the ExMon app via a link, and we got a few responses back. So there was a couple of people who just phoned reception and wanted to know why they'd been sent it. And the general feeling was there's a lot of people saying nobody's ever really been interested in my epilepsy. Why am I receiving this? But we had about 4 people who wanted to come in and have an appointment to discuss it and discuss their epilepsy. So that was kind of beyond the routine of the annual review. And one of them that was particularly, I think, important was this patient who came in and felt that their epilepsy was under control. They reported being seizure-free for a number of years. However, they did notice that there was a number of events happening that they weren't quite sure about. They lived on their own, and they'd had, for a few months, episodes where they'd wake up and they'd fallen out of bed, but they'd not woke up at the time that they'd fallen out of bed. They just woke up and they were on the floor. Or they woke up in bed, but they were feeling really achy with muscle aches and feeling like they'd run a marathon was their words. So we managed to refer back into neurology for review, and we had a conversation that potentially they were having some nighttime episodes, nocturnal seizures that they weren't aware of, and because they were living alone, there was no witness to this. So they were reviewed by their epilepsy specialist nurse, and their medication was titrated up in the evening. But we also had conversations around some monitoring devices that they had a conversation with me and with the specialist nurse, and then we were having a conversation with their family about the most appropriate, whether it be a watch device and something that would alert the family if there was any potential seizure activity, so they could either phone or come round and check on them. So that kind of came off the back of the Epsimon app being sent out. Going forward, we're starting to look at the learning disabilities review now, because this is a real opportunity. There is a high proportion of learning disabilities patients who have epilepsy. So this is a funded review. In our practice, we get an hour, so it's a real good opportunity to introduce the SUDEP checklist, talk to carers and families as well around the different monitoring, so the Epsimon, the Clive Tracy checklist as well, and incorporate that into the review. So this is where we're kind of going over the next year with what we can do next. So I think it's just trying to raise awareness of the importance of it, and that it's out there, that the checklist is available, because I think so many people just don't use it.